My name is David Hammersmith. I am the program manager here as well as one of the therapists.
Hi, I'm Kate Palmer and I am an advanced practice nurse. I specialize in psychiatry and I have a sub-focus in geriatric psychiatry.
Well, as some people might know, we recently moved from the 5th floor of Fulton County Health Center to our new space in an outpatient building. Still located on campus, but kind of an area more for ourselves and for our patients. It's really been a dream of ours because we've always wanted to expand some of our services, but with being on the 5th floor, there's not really a lot of space to expand outward. So now we have more of that capability for the future, as well as it just creating more of a better atmosphere for our patients.
It's a very welcoming environment. It's beautiful and very therapeutic.
Being over here, I think it's a lot more confidential, a lot more private. You're not having to go through the entire hospital to get to us. It just kind of creates more of a homey feel, which is just really helpful for the overall healing and therapeutic process itself.
So as a clinic here, we help treat and diagnose and also prescribe medications for mental health disorders for anybody 18 years or older.
Could just be that you've lived through this past year and have had a lot of stress going on. Maybe it's just normal life. Sometimes can be hard or give us surprises that we don't expect.
We work with many different mental health conditions, some that people are very familiar with, like depression and anxiety. We also treat things like PTSD. We treat obsessive compulsive disorders, insomnia, sleep disorders, and things like that.
One of our specialties is working with trauma. Maybe you've been through something really intense in the past that still kind of causes some problems in the present. One of those trauma therapies that we really focus on is called EMDR. This is really more of a cutting edge therapy that all of the therapists are trained in or familiar with. One of the other therapies that we also incorporate into what we do is cognitive behavioral therapy, which is about trying to change different thoughts to affect emotions or behaviors to change our thoughts and emotions. We also incorporate a lot of mindfulness therapies, really about trying to improve our awareness and ground us more in the present moment.
We also treat bipolar illness, which is actually a lot more common than I think a lot of people understand. Also, bipolar and many other things that we say in the community have been used as words we don't really understand, but bipolar as a mental health diagnosis really is something that is very difficult for patients and their family to deal with. Without treatment, it often can lead to hospitalizations or criminal things or many other things that can be very traumatic for families and people to deal with.
We also work on marital relationships, couples, trying to improve communication, relationship satisfaction. We also provide conjoint, which is also a situation where a patient might want to bring in somebody that's significant to them in their life. Maybe it's a family member, maybe it's a close friend where something just came up that they need to kind of work out in a session here or there.
We're excited to have this new opportunity because it means people don't have to go into the hospital to get their mental health services. They can come to a regular clinic. It feels like going to your primary care doctor's office or another clinic.
We have our therapists, we have our psychiatrists, our nurse practitioners, all working together, all in one place, working towards your goals, getting there in a more focused and efficient way, and just really helping improving that overall life satisfaction.
If you need help, please call the numbers available to reach out to us for an assessment or email or go to our website. Here at Fulton County in the Outpatient Clinic, we try to make it as safe and comfortable as possible. It's not very scary or intimidating to come into a place like this.